Well, welcome to all, and thank you for your participation in this, our fall 2022 Lupus, Georgia Lupus Collaborative Workshop. The goal of the workshop is as follows tonight: to hear from the participants and the recipients of our 2021 GCLEA grants. The members of the LFA team were awarded $25,000 to perform a lupus needs assessment in Georgia. So tonight we're gonna discuss the 2022 Georgia Lupus Collaborative grant request for the application process, and the council was allocated $30,000 to fund worthy individuals and/or organizations from Georgia that aspire to the GCLEA's mission and goals. Dr. Sam Lim and I will briefly review and answer any questions you might have about the RFA process and the grant submission process. And so without further ado, let's welcome Terry Iman, who will share the outcome of the project. Thank you, Terry, and it's on you.
Thank you, Kim, and thank you, Dr. Lim. And we are grateful to be here tonight. I'm Terry Iman, and I am the President and CEO of the Lupus Foundation of America, Georgia chapter. And as Kim said, we were very fortunate to be awarded the first inaugural grant for the Lupus Collaborative Grant, and we look forward to sharing information with you tonight. So the purpose of this grant was to execute a statewide needs assessment in Georgia. And the results of this are to identify gaps in current services and to provide that are provided to people living with lupus across the state. I want to make sure that we say from the get-go here that we want to frame tonight's conversation around the fact that these results are to be used to advance collaborative efforts and collaborative involvement so that we can take these, work with our collaborative partners and to make strategic initiatives and partnerships to improve the outcomes, health outcomes, and advance quality of life for people living with lupus in Georgia. But in everything that we're talking about tonight, we would like the members tonight on this call to think about how they could apply it to what they're doing in Georgia, because that's the beauty of this collaborative. And it's really when it comes together is when we're all working together in efforts to really improve the quality of life for people with lupus. So I would like to at this time introduce this fabulous team that worked on the initiative on the assessment with all of us together as a team. And we have Nina Smith-Bankhead, Alina McLean, and Chris Reed. And with that, I'm going to turn it over to Chris Reed, and he's going to start us off.
Good evening, everyone, and I thank you for being on this call this evening. In order to obtain a good representation of the people with lupus in this state from various regions of our state, the investigators, the four of us, decided to study and work with people living with lupus and people who support people living with lupus through our support group network. So we included members of the support group network, patients that were parts of the support group network, as well as support group leaders. In addition to working specifically with people living with lupus, we also chose to include stakeholders in our study. Stakeholders included caregivers of people living with lupus and people who work in the lupus community. In order to execute this needs assessment, we certainly needed an individual or individuals to evaluate the responses to our needs assessment. First, we included Emory University Rollins School of Public Health graduate students, and they were specifically assigned to study the outcomes and information provided by support group leaders and support group participants. In addition to the Rollins graduate students, we also chose Dr. Sinead Young of Morehouse College and her company, Young Consulting, as well as a few of her students. They were assigned with studying the evaluation provided by stakeholders, as well as they acted as the consultant on the entire study, combining the information obtained both from the Emory University group as well as their own studies to create a final report. Next slide. So I'm going to talk to you about the study design and methodology. We chose 300 persons living with lupus, and they received an email to complete the needs assessment survey evaluation. These patients were derived from patients in the LFA Georgia's support group list for the date between the dates of 2019 and 2022. Subjects had 15 days to complete the survey, and our results were we received 73 people living with lupus who completed all 35 questions of the survey, which amounts to 24% of a response rate. All respondents reported attending at least one support group in the last 3 years. As an incentive, persons living with lupus completed the survey evaluation within 15 days of receiving the evaluation were entered into a $100 raffle. Next slide. And then with respect to the stakeholders, we emailed 250 stakeholders who received an email containing the needs assessment. Stakeholders were also recruited at the Walk to End Lupus Atlanta, which took place in 2022. 35 stakeholders actually completed the entire survey at a rate of 14% response rate. Stakeholders who completed the survey evaluation within the time period were entered into a $100 raffle. Next slide.
Oh, I think I'm.
A total of 85% of people living with lupus were women, which means that we had a 14% response rate from males, which is really interesting considering that a majority of people living with lupus are female and 10% are male, which means that we had a greater response rate for men than we actually expected. 85% of participants identified as African American, and 40% identified as working full time. Next slide. And this is an example of our percentages. You'll see that we combined that we had one individual who chose not to identify their gender. And we had a pretty wide combination of races and ethnicities that responded to this particular program, this particular answer. Next slide. You'll also see that our education level is varied. 58% obtained a bachelor's degree or higher. 23% went to vocational school, and 18% graduated from high school. And now Alita is going to tell you a little bit about the results of the study.
Okay. Good evening, everyone. I am going to go over the components of the evaluation that involve the lupus participants. So with this program evaluation, the program evaluation was done to quantify the level of community outreach of the Lupus Foundation of America and gain a better understanding of current needs of lupus patients. So our first evaluation question was what methods of advertisement and outreach are most utilized by persons living with lupus. What we were looking at with this question was how people with lupus are currently receiving information and what is the best way to get them information. And as you can see from this slide, approximately a third of participants reported email, followed by Facebook and their healthcare providers as the primary source of information about lupus support groups. Persons with lupus also reported that medical providers, followed by Facebook, email, and Twitter, were the best way for lupus patients to learn about support groups. Nearly half of the participants would recommend the Lupus Foundation support group networks to another person living with lupus. Next slide, please. So with this second question, this will give the Lupus Foundation and the collaboration and stakeholders an idea of which doctors to target the recommendations from the needs assessment. And with this particular one, what we saw is that nearly half of the participants report receiving the majority of their lupus health and medical care from their rheumatologist and primary care physician. This question was also a check all that apply. So this was just the majority, the providers that had the largest response rate. Other providers that are not listed on the slide included dermatologists, gastroenterologists, nephrologists, and hematologists. Next slide, please. And this question here is kind of rather important. As a community striving to keeping patients healthy and engaged in care, these responses will provide the LFA and the community on what resources and collaborations to kind of look for. So this question of what are the barriers that have prevented lupus patients from accessing care or seeing a healthcare provider. And persons living with lupus were asked what barriers had prevented them from accessing care or seeing their provider. Slightly over half of the participants reported that they do not miss healthcare provider appointments. However, for the participants who did report difficulty in seeing their provider, work conflicts were the most frequently endorsed response, followed by finances as the other barriers to preventing people from seeing their healthcare provider. Next slide, please. Okay, so lupus support group members were asked about their ability to understand and manage their chronic disease. When asked how well they understand what it means to be diagnosed with lupus, participants reported that they understood their diagnosis, the reasons for taking their prescribed medications, the importance of regular lab blood work, and their actual care plan. Persons, as we can see from the slide, we can assume that persons involved in support groups are highly knowledgeable and shows the effectiveness of support groups in terms of helping patients understand their disease management. And the next slide, please. Okay, and now I will turn it over to Nina Bankhead to go over the stakeholder findings.
Good evening, everyone. And so I'll talk a little bit about the stakeholder findings. So just to give you a quick overview, as you can see from the slides, the survey respondents, as was mentioned earlier, were all affiliated with different organizations. So the largest number came from the Georgia Society of Rheumatology, which is around 17%, and the American College of Rheumatology. 15% of the participants reported living with lupus, so that was slightly over half of all of the respondents reported that they currently worked with people living with lupus. And the average number of years participants reported working with people living with lupus was 12 years, and the median was 9 years. So you can see on both of these tables just a breakdown of who the various people were, what some of their roles have been. And so just wanted to point that out. So you can see we had some social work engaged folks. We had healthcare medical providers, caregivers, researchers, advocates involved. And you can see the different organizations that are pretty reasonably spread out in terms of where the stakeholders came from. So next slide. Okay. And so the next question was asking about people's level of experience for those who said they were working with, or for those who answered, those who are working with people with lupus. We wanted to get an idea of their level of experience with people living with lupus. And so we asked stakeholders to rate their level of experience working with people. The majority, about 47% of stakeholders, rated themselves as competent in terms of their level of experience working with people living with lupus. And then the next largest group were people who said they were proficient. And we had about 5 people, or 15%, that said that they were expert or had an expert level of experience working with people living with lupus. Next slide. Okay. So this question was asking about the knowledge and the confidence, or the amount of confidence that people felt who were working with those who are living with lupus. And we wanted to get an idea of those stakeholders who are either caregivers or some other level of a professional who work with people, to understand whether they felt comfortable, whether they felt knowledgeable, and if there were some gaps in their knowledge that could be filled by the various stakeholder groups that serve this community. And so we asked them to rate that perceived level of training and or preparedness. Most of the stakeholders rated their training as good, about 51%, or excellent, 26%. When asked how confident providers or stakeholders were when working with people living with lupus, most stakeholders rated themselves somewhat comfortable, around 51%, or extremely confident in working with or on behalf of people living with lupus. We also queried stakeholders about how knowledgeable they felt about lupus treatments, and the majority reported that they felt moderately knowledgeable, 45%, or very knowledgeable, 7%, and then about 14%, or 5 of our respondents, felt that they were extremely knowledgeable. Next slide. We also, again, just to look at knowledge more, we asked stakeholders their perceived knowledge of lupus treatments themselves. And again, about 46% of the respondents said that they were moderately knowledgeable about lupus, and about 20% said that they were very knowledgeable. Next slide. And then when we asked specifically about areas that, and I know this slide is very small, so we could try to make it a little bigger, but we asked the stakeholders what areas would they be interested in getting more training in. And there were, the responses varied. So we had responses that included learning more about teens living with lupus. We heard about clinical education. People were interested in more online webinars, comorbidities and therapies, clinical education. A lot of the responses had to do with treatment or clinical type issues. But then there were also people who wanted to know what should they look out for in terms of diagnosis or symptoms. There were some folks that responded about lupus in pregnancy. So I'm just sort of jumping around a little bit, but there was a variety of different questions or responses. And there were also some responses that, or a response that was to learn more about being culturally responsive or culturally appropriate in interactions with people living with lupus. And I think that sort of one of the earlier slides had a pretty small number of people who said that some of the people living with lupus talked about having bad experiences. And in some of that information, I think some of it also pointed to some cultural diversity type interactions. So, and next, Chris will talk a little bit about conclusions related to this study. Chris?
Most of the people living with lupus reported managing their lupus well, rarely missing healthcare appointments and attending support groups monthly. Where conflicts and finances were the biggest challenges to treatment, healthcare providers and social media were their top sources of health information. Most stakeholders reported working with or on behalf of people living with lupus for an average of 12 years. And they also reported receiving adequate amounts of training or education to effectively work with and care for individuals living with lupus. Interestingly, most stakeholders rated themselves as competent, followed by proficient regarding their level of experience working with people living with lupus. Next slide. And now Alita is going to talk about recommendations.
Yes, these were some of the recommendations that came out of our evaluation from our evaluators that assisted us with the survey. So the first recommendation was based on the needs assessment data, both from people living with lupus and the stakeholders, the development of a comprehensive health communication plan would be helpful to assist persons living with lupus and stakeholders access the information. So this is really talking about ensuring that the work that is being done goes beyond just the support groups, but that we're able to extend our information and support in a statewide effort. The second recommendation, most people living with lupus report getting their information from healthcare providers. Therefore, ensure that rheumatologists, primary care physicians, and other healthcare care providers are familiar with updated lupus screening and treatments. And I think this too kind of goes into more of a collaboration that can happen between providers and community agencies such as the Lupus Foundation, and them updating the foundation on updated treatments and work in as the foundation has that relationship with the community and lupus patients, we're better able to communicate updates and treatments of things that are going on. Recommendation number 3 was healthcare providers should be aware of challenges for patients getting to appointments and adhering to treatments. Work conflicts were listed as a top challenge for getting to appointments. Additional resources for financial support should be placed in healthcare provider offices, in addition to discussing treatment options and possible side effects with patients, which may be a deterrent to treatment adherence. Having flexible appointment times and the use of telemedicine when possible may be advantageous for some persons living with lupus. This one here is kind of a big recommendation. It hits on a lot of points, including even some advocacy efforts. So for our persons that are on the call who are involved with advocacy or are stakeholders that are involved with providing community resources, this is more getting at how the patients and their barriers, and how do we eliminate those barriers to get more people into care. So if they're not able to take off work, that's probably an issue. But if it's financial, we know that's not always something that the medical provider can do, but having those relationships with community organizations that can provide those resources so that we can get people to their appointments. And as we are developing treatment plans and recommendations, taking all these barriers into consideration for the patients to make sure that they're better able to comply with their care. Recommendation number 4, stakeholders provided recommendations on additional training and education that they would like to receive. The recommendations cover multiple topics, including working with teens, comorbidities, and a few individuals discussed more resources for culturally appropriate, including language, interactions, and working with diverse populations. Again, I think this is where more collaborations can take place, and identifying ways that the community can get together to hold, update the physicians too on other things outside of the medicine, but on the cultural diversity training, making sure that's taking place in the practices, and working with other comorbidities. As people are living longer now with lupus, they're dealing with other comorbidities outside of the typical joint pain. They're also dealing with, as people age, their diabetes and hypertension and other things. So making sure that we consider all of those things as people continue to age and live longer with lupus. And the last recommendation was stakeholders need ongoing education about the treatment of lupus, in addition to ongoing training around work with diverse populations and for healthcare providers, the provision of culturally linguistic appropriate service standards. And again, I mean, I think we've mentioned that several times about just making sure that our practices are culturally appropriate, so that when persons are receiving care, that they feel comfortable in that environment, which will help with their treatment. Next slide.
Awesome. And I'll just wrap up with, or wrap up the review of the actual evaluation with a few next steps. And so future data collection effort. So let me back up. One thing that we realized soon after we completed the study was that there were a couple of things that we would have liked to ask that we did not have an opportunity to, or that were inadvertently omitted. One was to get more information about age for each of the respondents. And also we recognized that we also didn't collect the location, which we know can have some impact on some of those challenges and barriers that people experience. So those are two areas that if we were to repeat this evaluation, we would make sure were included. Overall, we know that the stakeholders in this needs assessment reported receiving adequate training and education. So most people felt fairly confident, but we did identify some potential gaps in optimizing care for people living with lupus. And those gaps, once we address those, can ultimately help to improve the health outcomes and advance the quality of life for people living with lupus in Georgia. And so future data collection efforts should really focus on people who are not in care, because I think one of the things we know is that those people who are in care or who have encountered support groups have a fairly high level of knowledge. And so we want to better understand what's going on with those people who haven't encountered support networks, who may not be in care. And so we've talked about ways to reach out to other providers that may gain us access. And so to gain more in-depth understanding of people living with lupus and stakeholders, data collection should be expanded to include key informant interviews so we can get more rich data, as well as focus groups that will help us get more detailed data and provide some context around some of those initial findings that we spoke about earlier. We also recognize that this data can be used to inform strategic planning processes for all of our various lupus stakeholders, including our advocacy activities, as Alita mentioned. These findings point to the importance of engaging additional stakeholders, even thinking about some non-traditional medical providers or care providers, so that we can find other spaces where people living with lupus may be engaging in some level of their care. And strategic partners to help serve the needs. So again, as Alita mentioned, thinking about who we can partner with, so when our clients or people living with lupus are in need of transportation assistance, who can we reach out to? Or if they're in need of discount healthcare cards and things like that, or other support services, mental health services and all of that, we have a seamless referral and connection process. Future needs assessments should be conducted at least every 3 to 4 years so that we can continue to inform and assess our activities. And future needs assessments may also disaggregate data based on demographics. So we know that there are some, we may want to separate out the caregivers from the providers, from the patients a little bit more so that we could truly understand what each group experiences. And that'll help us get a more complete understanding of each stakeholder's needs. Next slide. And so I'll turn it back over to Terry.
Okay. At this time, we would like to open up for any questions that you may have. And before we do that, I really want to thank this team, Chris, Alita, and Nina. From the time that we decided as a group to go for this grant, which was in early December, until the completion of the project in June, we met sometimes 2 and 3 times a week to put the grant together, to evaluate, to work with the stakeholders, to work with the evaluators, and come up with the final report. So they put a lot of time and effort, and most of it was evenings and weekends because they all hold day jobs. So I just want to really thank the 3 of you for all your hard work that you put into this. So at this time, let's open this up. Does anybody have any questions for us?
This is Becky or Rebecca. You guys did a great job. I'm sorry, I'm having some issues with my camera tonight, but regarding the issue of kind of the work conflicts that they can go into the doctors and so forth, did they go into more specifics in that it was either they didn't have the time issue or possibly that their employers didn't really know of their condition, or did they expound on any of that, why they couldn't get to the, utilize or get to their doctors? Did they go into any more depth on that?
It wasn't a lot of free form with the question, but in the context of the way it was answered, it was more of either they didn't want to or couldn't take off of work for their doctor's appointments.
Okay.
Now, that was a limitation that we perceived, was that it was about not having the time off to do it. Do we have any other questions? That's a great question, Becky.
This is really an amazing effort, and I just want to applaud you all again. I'm still, after my 3rd or 4th read, digesting a lot of information, so forgive me, but I think we'll continue to digest it as a community moving forward, as we should. I just want to throw out that goal, the Georgians Organized Against Lupus research cohort that many of you participate in. We focus mostly in the Atlanta metro area. We hope to expand. But that could be a collaboration in the future, at least for the Atlanta area participants, to dig deeper into some of these questions. We were funded for the next 5 years with the CDC. We've got a renewal. We have not a ton of space in some of our surveys, but we do have the opportunity to dive into some of this a little bit more. So I just throw that out there. And I had a question about a couple of the recommendations actually really brought out issues of cultural appropriateness. And Nina, you actually specifically talked about in the category of bad experiences, you mentioned cultural diversity. Can you all be any more specific as to what some of these respondents meant by that, or what some of their experiences were?
Nina, do you want to speak to that?
Yeah, I would need to, unfortunately, I can go back through the data. I would have to go back to the data to quote a specific experience. But I would say anecdotally, I think, and Alita, I don't know if Alita or Chris can add anything, but I think that category of bad experiences sometimes comes with just a feeling of not being understood or not being heard. And so, but I would have to dig into the data more to give a very specific response.
Yeah, and I agree with Nina, and I think some of it has to do with representation. So it could be perceived diversity because of the lack of representation of what the population looked like and what the providers present as. And then there was also the mention of specifically the language barrier one.
Yeah.
So if you're going to a provider that doesn't really speak your native language, sometimes that's a negative experience as well.
And I think some of these questions that we're coming up with tonight are great opportunities for a more in-depth needs assessment again. And we had talked about that. With more time, we would have loved to have done focus groups and really do. And we also would love to do more collaboration with the Goal Project, Sam. Absolutely. Because we'd love to avail ourselves of the data that you have and not duplicate it. But we really used, we were lucky because we used your data to secure the grant, because you set the purpose for us to do it. So we appreciate that. But we really foresee in the future needs assessments to not only reach out to people who are not in care, but also to dig deeper into why people can't get to the doctor and why they don't, what is their problem with their doctors, and really go into those and do that through focus groups.
I can kind of elaborate on the cultural competence. So a number of stakeholders did respond, indicating that they feel that they need more education on cultural competence as well as cultural appropriateness in clinical setting. There is one quote directly from one of the respondents. It says, "I feel that I lack training and understanding the needs of minority populations, which is the majority of our cohort. As a non-minority, I sometimes feel that I am not able to relate to participants and therefore do not collect accurate data." So that's just an example of one situation from one, possibly a clinician who possibly needs more information regarding the groups that he or she may work with.
Yeah. It's also very enlightening and hopeful that they're able to see that and acknowledge that. So that's
Very hopeful, very, very much so.
And there's an opportunity for, in terms of what is not in the wheelhouse of the LFA, to do professional training for somebody to tag on in the collaborative, to take on something like that.
An excellent segue.
Pardon me?
Can I, Cynthia, good evening all. I'm very impressed and I'm so complimentary of all of you and the efforts. And I think it's of a deep interest, and with the precision that you've engaged, I believe we can train one another. Those of us who take an interest in engaging our patients, particularly the clinicians who are affinite and comfortable with the cultural engagement. We could train one another, and I think workshops could be enlisted. I think Chris kind of gave an intro to that. So I think workshops for clinicians would be something that we could possibly introduce, Terry.
Okay, that's a great idea. Okay. Any additional questions or comments before we move on to the next grant cycle? Well, I want to thank you all for taking time tonight to listen to us. And at this point, I'm going to turn this over to Dr. Lim, and I make him the host here.
So if you go to the website here, you can Google GCLEA and lupus and you should see it, but the URL is galupuscouncil.org. And you can peruse the different sections, but I'm pointing out, you'll see on the header here, a couple sections on the collaborative grant. And so the main section here, the purpose of the grant is in line with the purpose of the GCLEA. It's really no different, and that is to improve the lives of citizens of Georgia who live with lupus and or their caretakers. And so that's a very broad charge, and under which you can propose many different things. So, keep thinking about that. You can be extremely creative in taking advantage of this opportunity. And it was mentioned earlier, this is so important to the council that we actually increased the budget for it from 25,000 to 30,000 this year. The application deadline is about, was it 6 or so weeks away? Yeah, maybe a little over 6 weeks away, but it's in the middle of November. And the funding period would start on February 1st and go through the end of June. So about 5 months, but it's 5 months to really take advantage of this opportunity and get something done that you wish that you could get done, but just didn't quite have the resources or maybe the network or collaborations to do so. You can see the funding criteria here. There's some broad areas. As you look through this, and I encourage you all to come into this website, and there's another section of the website on FAQs related to the proposal. Let us know if you have any questions. There's an email link there as well. But when you think about this, some of you may be thinking, I've never done anything like this. I don't know how. I have this idea. I have this passion. Get a list of the people in the collaborative. Look at the names that you've seen on these meetings, and maybe others have the same sort of passion, but complementary skills and resources that they can partner with you. Try to get a group of people out there, and this is really part of the dream of the council, that this would help facilitate these interactions, the networking, the collaborations that have been building, but we want it to continue and increase even more. And the final thing that I'll say is with my council hat off, and this is really a personal statement, is that I do hope that we continue to get more information. We need that. And so data is key. So don't hear me first and foremost that I think in some ways, whether it's through this grant or further collaborations with the GCLEA, with the LFA, I do hope that we build on this work that was just presented. But my other hope is that we start acting. Data at the same time, we don't want to keep collecting information. I think we have very discrete areas that have been identified by this needs assessment that have clear data behind it. And I know many of you have some great ideas and are already probably doing some activity in this space. We need to start making a difference, a tangible difference in the lives of people in Georgia. And so that's my personal hope, that more projects come out of the GCLA and the state, not only from this grant, but from the collaborative as a whole along those lines. That's it for me, Terry. Thank you.
Okay. Well, does anybody have any questions about the request for proposal? I put in the link, the link to the actual application. So that's in the link there for anybody who wants it. And I want to reiterate and thank Sam for really talking about this. Well, data is key. It's absolutely key. It drives and informs us. But we want to start working on some of the findings that we had, whether it's digging deeper in things, but I really think the areas of communication and cultural competency are two areas that we really need to look at to see how we, if we're not communicating effectively with our community, it doesn't matter what we're doing if they don't know about it. And if our providers aren't gaining the trust of the patients that they're working with, and if the chapter isn't gaining the trust of them, then that's something that we all have to work on. So thank you for reiterating that, Dr. Lim. And does anybody have anything to add? Any questions?
You also keep in mind that we don't have to award just one grant. We can, if there are more than one amazing ideas and we can fit it all within the budget, that's what we'll do.
That's a great point.
I just have a really quick question. When they were talking about as far as communication with different nationalities, other than Spanish, what other did they state? What other languages are we having some issues with?
Thank you, Becky. The statements or the responses specifically say, indicate just minority populations. So it's not specific as to race or ethnicity.
Okay.
Okay, any other questions or comments before we close out here? Well, once again, I want to thank all of you for joining us tonight. Take a look at the request for proposal and the needs assessment as a whole. But there's a lot of information in there. If you have any questions at all, you know how to contact us, and we look forward to our next collaborative workshop. Thank you, Dr. Lim. Thank you, Representative Schofield, and thank you, Chris Reed, Alita McLean, and Nina Smith-Bankhead for your presentations tonight.
Thank you.
Okay, good evening.
Thank you, everyone.
And everyone, thanks for joining.